Good afternoon. Thank you. I'll stand over here. Good afternoon. Thank you very much for making me welcome. I'd like to start by thanking the team that's worked with this from the Faculty of Health at QUT. So firstly, thank you to Dr. Cynthia Cliff, who is with us today. Thank you also to Alison Vorton and Dee May, who aren't with us today, but also Alison Bateman, who is our project officer across this project, who has just been invaluable in helping to pull this together. And as I start to explain what we've done, I think you'll understand what a job it's been for a project officer to coordinate what we've put together. So we looked at chronic disease outreach student clinics into aged care. So we had some major objectives. Firstly, to create sustainable training places through a network of aged care facilities and Aboriginal and Torres Strait Islander healthcare providers, so key sectors for chronic disease. Provide students with a variety of opportunities to experience delivering care in the context of multidisciplinary healthcare delivery. Deliver student services, and I think this is quite key to what we've done and something we're very proud of, is deliver free supervised student services in the screening and delivery of healthcare, delivering in effect real and necessary occasions of care that may not otherwise have been delivered. And I think that's tremendous, that not only did we deliver placements, but we delivered real healthcare and increased clinical training capacity. So to explain the placement model, some disciplines, and I think any of you who work with across a number of disciplines understand, very little aligns, very little looks the same from one discipline to the other. So we had to work within the constraints of that. So we had some disciplines that could only work in a block placement model. Other students, we were lucky that we could take out on a fortnightly basis and actually run outreach clinics, which was the core of the idea. So block placement, pharmacy. We were able to put them into Think Clinical, and this is a very new placement for us at QUT. Think Clinical has their arm that deals with residential aged care, particularly around the RMMRs, so looking at the medication management. So our students were really immersed in delivering, within the context of their discipline, as a part of healthcare for the aged care community. And nursing, again, they work on block placement, so we were able to send them out into a number of brand new placement sites as a function of this project. Excitingly, with the chronic disease clinics, again, we were able to send the students out because of their disciplines. They could go out on a fortnightly basis. But we had to look at how that had to work differently across disciplines. So in the first instance, we had some where we sent the QUT supervisor out with the student. This took the pressure off the facility. We were able to deliver the care without interrupting the normal business, and hence became a part of the workforce during that period. In other cases, as for the example of psychology, the students were attached to Villa Maria Centre, which is in Fortitude Valley. Clients were identified as possibly benefiting from psychological services. Appointments were set up, and the students went out and took the appointments and received supervision back at QUT. So a major part of this, in fact, was delivering the supervision via QUT, which did take the pressure off the facilities. So one of the major outcomes, create this new network, and that we did. A number of new residential aged care facilities are now part of our network for placements, whether it's block placements or whether it's looking at continuing our outreach. In total, we delivered 4,309 hours of clinical placement. By far and large nursing, because it is block placement, but again, we've got some really good figures sitting there across the other disciplines as well, including pharmacy, podiatry and optometry, which worked across both aged care and our Aboriginal and Torres Strait Islanders clinics. Combined is quite a number of hours for that discipline as well. 64 outreach clinics. So now if we just move away from the block placements and look at what was really quite innovative, excuse me, the outreach clinics, really exciting, and we delivered 64 of them across the length of the project. So that's 64 times we went out into the community and delivered care that may not otherwise have been delivered. And psychology sits to the side because it was just that little bit unique again, where it was one-on-one client and psychology therapist, and so we had 4 clients there. So this is an example. We've still got some clinics going on, and I'm not going to show you all of the data at this stage, but just to give you a sense of this is what the sort of data you can collect from a project like this, which is really going to help us understand down the track and in terms of sustainability, what are we doing, what are we delivering, and do we need to concentrate on specific areas of care and specific areas of training before the students go out. And we've got this across all of the disciplines. We talked about the increased clinical training capacity. Because we supplied QUT supervisors across most of the disciplines, it was really nursing where we went out and we said to the facilities that were new to our network, how can we support you, how can we support your RNs, those that will be supervising, and we put together clinical supervision for those particular supervisors and provided them with certificates for CPD. Again, I think aged care is one of those environments where professional development is a little bit harder to come by, so I know that was really appreciated and seen as a real gesture of gratitude from QUT that we were able to support them in this way. So we surveyed the students. It's still preliminary data. There's a number that haven't been surveyed as yet. To date, 37 responses. 62.2% of the students actually selected to go on to these placements, which is a great response. All of our respondents in the outreach clinics and indeed in our nursing outreach clinics, sorry, I'll just step back a bit. We surveyed the outreach clinics students because they were the placement that were new, we were piloting, and we wanted to understand rather than the block placements. So 37 of the students that went on outreach were surveyed. The outreach students were all 4th year, 5th year or master's students, and only 9 of these students had ever had a placement in aged care. So I think that's really quite startling that by the very end, in the case of 4th year, 5th year and masters, the real end of their education, their clinical placement, and they've not been in aged care. So we asked them why. Why did you want to do this placement? The majority, specifically to learn about delivering health care to ageing populations, and a number of them identified that it's variety, it's a different population for us to understand. In terms of general experience, 64.8% of the respondents responded that they rated their placement as relevant to their career decisions, indicated they would now seriously consider a career in aged care following the placement. And we in fact asked them before placement, how seriously were we considering a future in aged care, and then following placement, how do you now feel about a future in aged care? And in fact, there's a significant difference. So we know the impact of placement in this aged care setting allowed them to think more seriously about this as a real possibility for their future. The most important personal skill that students felt that they gained was communication and listening skills. A number of them really remarked, I learned how to be caring, I learned how to show empathy, I learnt to respect older people. So there were some great results. And the most important professional skill, also communication. So that was very, very much a theme. Obviously the students really identified that communicating with this population was somewhat different to some of the skills they've learnt prior, and this was a great opportunity. And in terms of our future focus, we will be continuing our student outreach clinics. We've got fantastic relationships now with our partnering institutions. In particular, one of the residential aged care facilities at which we conducted outreach clinics has asked us to collaborate on a rather large grant to look at running these for 3 years in terms of community servicing chronic disease in the community. So I think that speaks volumes in terms of how valued the student services were seen by the facilities also. So great quality clinical placements, real and necessary care delivered in a professional manner by the students, and sustainability so we can go forward and continue to play a real role in the community while satisfying our core business needs. Thank you.